Describe the physiological mechanisms that regulate blood pressure in the human body. In your answer, include the roles of the baroreceptors, renin-angiotensin-aldosterone system (ROS), and the impact of the autonomic nervous system. Answer: blood pressure regulation is a complex process involving several mechanisms. Baroreceptors. These are specialized stretch receptors located in the carotid sinuses and aortic arch. They detect changes in blood pressure and send signals to the medulla oblongata in the brain. When blood pressure rises, baroreceptors increase their firing rate, leading to increased parasympathetic output, vagal tone, which decreases heart rate, decreased sympathetic output, which leads to vasodilation and reduced cardiac contractility. Renin-angiotensin-aldosterone system (ROS). This system is activated when there's a decrease in blood flow to the kidneys. Renin, an enzyme released by juxtaglomerular cells, converts angiotensinogen to angiotensin I, which is then converted to angiotensin I by angiotensin-converting enzyme ACE. Angiotensin RON2 causes vasoconstriction, increasing systemic vascular resistance. Stimulates the adrenal cortex to release aldosterone, promoting sodium and water reabsorption in the kidneys, which increases blood volume and pressure. Autonomic nervous system. The sympathetic nervous system releases norepinephrine, leading to increased heart rate and force of contraction as well as vasoconstriction. The parasympathetic system, primarily through the vagus nerve, works to lower heart rate and promote vasodilation. In summary, blood pressure is tightly regulated by these feedback mechanisms to maintain homeostasis. Understanding the interplay between these systems is crucial for managing conditions like hypertension. Explain the mechanics of breathing during inspiration and expiration. Include the roles of the diaphragm, intercostal muscles, and the changes in intrathoracic pressure. Answer: breathing involves two main phases, inspiration and expiration, facilitated by changes in thoracic cavity volume and intrathoracic pressure. Inspiration. Diaphragm. The diaphragm is the primary muscle of inspiration. When it contracts, it moves downward, increasing the vertical dimension of the thoracic cavity. Intercostal muscles. The external intercostal muscles contract, lifting the ribcage and increasing the anteroposterior dimension of the thorax. Intrathoracic pressure. As the thoracic cavity expands, the pressure decreases. Intrapleural pressure becomes more negative, creating a pressure gradient between the atmosphere and the lungs, allowing air to flow in. Expiration. In quiet breathing, expiration is typically passive. The diaphragm and intercostal muscles relax, decreasing the thoracic cavity volume. The elastic recoil of the lungs leads to an increase in intrathoracic pressure, pushing air out of the lungs. During forced expiration, e.g., during exercise, the internal intercostal muscles and abdominal muscles actively contract to further decrease the thoracic volume. This dynamic process is essential for gas exchange and maintaining appropriate levels of oxygen and carbon dioxide in the bloodstream. Discuss the mechanisms by which the kidneys contribute to acid-base homeostasis. Include details on bicarbonate reabsorption, hydrogen ion secretion, and the role of ammonium. Answer: the kidneys play a crucial role in maintaining acid-base balance through several mechanisms. Bicarbonate reabsorption. In the proximal convoluted tubule bicarbonate, ATIA is reabsorbed. This process involves the conversion of HCl to carbonic acid, HCO, by the enzyme carbonic anhydrase. HCO dissociates into water ion carbon dioxide, CO, which can diffuse into the tubular cells. Inside the cells, CO combines with water to regenerate HCO, which is transported back into the bloodstream. Hydrogen ion secretion. The kidneys secrete hydrogen ions H into the renal tubules, which helps to excrete excess acidity from the body. This process is crucial for maintaining a normal blood pH. Ammonium role. In addition to secreting H, the kidneys produce ammonia NH in the renal tubular cells. Ammonia can combine with H to form ammonium NH, which is excreted in the urine. This mechanism allows for the excretion of acid without significantly altering blood pH. Compare and contrast the hormonal regulation of the male and female reproductive cycles, highlighting the roles of key hormones such as FSH, LH, estrogen, and testosterone. Answer: the hormonal regulation of the male and female reproductive cycles involves different hormones but shares some common pathways in the hypothalamic pituitary gonadal (HEG) axis. Female reproductive cycle. Follicle stimulating hormone FS8 stimulates the growth of ovarian follicles and estrogen production. Luteinizing hormone LH triggers ovulation and promotes the formation of the corpus luteum, which secretes progesterone. Estrogen promotes the proliferation of the endometrium in preparation for potential implantation. progesterone, stabilizes the endometrium and prepares it for implantation. If fertilization does not occur, progesterone levels drop, leading to menstruation. The female cycle is characterized by the follicular phase, ovulation, and luteal phase, typically lasting about 28 days. Male reproductive cycle, FSH, stimulates spermatogenesis in the testes. LH stimulates the Leydig cells in the testes to produce testosterone. Testosterone, responsible for the development of male secondary sexual characteristics, libido, and the regulation of spermatogenesis. Unlike the female cycle, which is cyclical, the male reproductive cycle is more constant, with testosterone levels fluctuating throughout the day. Both cycles illustrate the intricate interplay of hormones and feedback mechanisms necessary for reproduction. Mr. Thompson has been experiencing significant digestive issues, including nausea and difficulty digesting fatty foods. Upon examination, his doctor suspects a problem with the secretion of certain gastrointestinal hormones. What hormone might be deficient in Mr. Thompson's case, and what is its role in digestion? Answer: in Mr. Thompson's case, the hormone likely to be deficient is cholecystokinin CK. The role of CK. CCK is secreted by the I cells of the duodenum in response to the presence of fatty acids and amino acids in the intestinal lumen. Its primary functions include stimulating the gallbladder to contract and release bile into the small intestine, which is crucial for the emulsification and digestion of fats, promoting the release of pancreatic enzymes, which aid in the digestion of proteins and carbohydrates, slowing gastric emptying to allow for optimal digestion and absorption of nutrients. A deficiency in CCK could lead to impaired digestion of fats, resulting in symptoms such as nausea and difficulty digesting fatty foods. Explain the mechanisms involved in glomerular filtration and the subsequent tubular reabsorption processes in the nephron. How do these processes contribute to the regulation of blood composition? Answer: glomerular filtration and tubular reabsorption are critical processes in the nephron that regulate blood composition. Glomerular filtration occurs in the glomerulus, where blood is filtered through the glomerular capillary walls, driven by hydrostatic pressure. The filtration barrier includes endothelial cells, the basement membrane, and podocytes, which prevent the passage of large molecules, e.g. proteins, while allowing water, electrolytes, and small solutes to pass into the Bowman's capsule. Tubular reabsorption. After filtration, essential substances like water, glucose, and electrolytes are reabsorbed back into the bloodstream along the nephron's various segments: proximal tubule, loop of Henle, distal convoluted tubule. Proximal convoluted tubule, PCT. The majority of reabsorption occurs here, with approximately 65–70% of filtered water and sodium reabsorbed, alongside almost all glucose and amino acids via active transport mechanisms. Loop of Henle. The descending limb is permeable to water, but not to solutes, while the ascending limb is impermeable to water and actively reabsorbs sodium, contributing to the osmotic gradient in the medulla. Distal convoluted tubule and collecting duct. Fine-tuning of reabsorption occurs here, regulated by hormones like aldosterone promoting sodium reabsorption and antidiuretic hormone A promoting water reabsorption. Together, these processes help maintain blood volume, electrolyte balance, and acid-base homeostasis, which are vital for overall physiological function. Discuss the concept of feedback mechanisms in physiological processes, specifically focusing on negative feedback and its role in homeostasis. Provide an example of a physiological system that employs negative feedback. Answer: feedback mechanisms are essential for maintaining homeostasis in the body, primarily through negative feedback loops. Negative feedback. This mechanism counteracts deviations from a set point, promoting stability in physiological systems. When a change occurs, an increase in body temperature, the body activates processes that counteract that change, e.g. sweating to cool down. Example: thermoregulation. The hypothalamus acts as the body's thermostat, and when body temperature rises above the normal range, approximately 37 deg, thermoreceptors signal the hypothalamus to initiate cooling mechanisms. Vasodilation of peripheral blood vessels increases heat loss through the skin. Sweating promotes evaporative cooling. Conversely, if body temperature drops, the hypothalamus triggers vasoconstriction and shivering to generate heat, illustrating how negative feedback maintains body temperature within a narrow range. Analyze the role of the kidneys in regulating acid-base balance, focusing on the mechanisms of bicarbonate reclamation and ammonium production. How do these processes interact to maintain pH homeostasis? Answer: the kidneys play a pivotal role in regulating acid-base balance through bicarbonate reclamation and ammonium production. Bicarbonate reclamation. In the proximal tubule, bicarbonate HCO is filtered and needs to be reabsorbed to maintain plasma levels. This process involves carbonic anhydrase catalyzes the reaction between Co and Ha to throw HCO, which dissociates into H and HCO. HCO is reabsorbed into the bloodstream while H is secreted into the tubular fluid, thus reducing acidity, ammonium production. The kidneys generate ammonia NH in tubular cells, which can combine with H to form ammonium NH. This process is critical during acidosis as the excretion of NH allows for the elimination of excess acid without significantly altering blood pH. Ammonium production increases when blood pH drops, enhancing acid excretion. Explain the cardiac cycle, detailing the phases involved and the corresponding heart sounds associated with these phases. What physiological events correspond to the first and second heart sounds? Answer. The cardiac cycle consists of a sequence of events that occur during one heartbeat, including the contraction and relaxation of the heart chambers, leading to blood flow through the heart and to the body. Phases of the cardiac cycle. Diastole. The heart muscles relax, allowing the chambers to fill with blood. Atrial systole occurs at the end of diastole, where the atria contract, push additional blood into the ventricles. Systole, the ventricles contract, leading to the expulsion of blood. Ventricular contraction begins, causing the closure of the atrioventricular valves, which corresponds to the first heart sound, as blood is ejected through the aorta and pulmonary artery, leading to the closure of the semilunar valves, which corresponds to the second heart sound. Heart sounds. The first heart sound occurs at the beginning of ventricular systole, when the AV valves, mitral and tricuspid, close. This sound signifies the onset of ventricular contraction and is often described as a lub. Second heart sound occurs at the end of ventricular systole, when the semilunar valves, aortic and pulmonary, close. This sound signifies the end of ventricular contraction and is described as a dub. Understanding the cardiac cycle and the associated heart sounds is vital for diagnosing and managing cardiovascular conditions. Compare and contrast steroid hormones and peptide hormones regarding their classification, mechanisms of action, and physiological effects. Answer. Hormones can be classified into two major categories: steroid hormones and peptide hormones, each with distinct characteristics and mechanisms of action. Steroid hormones. Classification: lipophilic molecules derived from cholesterol, e.g. testosterone, estrogen, cortisol. Mechanisms of action. Steroid hormones can easily diffuse through cell membranes due to their lipid solubility. Once inside the cell, they bind to specific intracellular receptors, forming hormone receptor complexes that translocate to the nucleus and initiate transcription of target genes, leading to protein synthesis. Physiological effects. Their effects are generally slower to onset but longer lasting, influencing processes such as metabolism, immune response, and reproductive functions. Peptide hormones. Classification: water-soluble molecules composed of amino acids, e.g. insulin, glucagon, growth hormone. Mechanisms of action: peptide hormones cannot diffuse through cell membranes. Instead, they bind to receptors on the cell surface. This binding activates intracellular signaling cascades, often involving second messengers like CAM, leading to rapid physiological responses. Physiological effects. Their effects are typically quicker than those of steroid hormones, regulating processes such as blood sugar levels, growth, and metabolism. Understanding the differences between these hormone types is essential for grasping their roles in various physiological processes and their implications in health and disease. What is the primary strength of a cohort study compared to a case control study in investigating the relationship between smoking and lung cancer? Discuss the implications of these study designs in determining causality. Answer. Cohort studies follow a group of individuals over time to see who develops the outcome of interest, while case control studies start with individuals who have the outcome and look back to determine exposure status. The primary strength of a cohort study lies in its ability to establish the timing of exposure relative to the outcome, which is crucial in determining causality. In a cohort study, researchers can assess the incidence of lung cancer in smokers versus non-smokers directly, providing a risk ratio error that quantifies the strength of the association. This prospective design minimizes recall bias, common in case control studies where participants may not accurately remember past exposures. The guidelines from the Centers for Disease Control and Prevention (CDC) emphasize the importance of cohort studies for assessing long-term outcomes and establishing temporal relationships in public health research. Cohort studies are generally considered more robust for causal inference due to their design, allowing for direct observation of risk factors and outcomes over time. Mr. Anderson, a 45-year-old man, is participating in a clinical trial for a new antihypertensive medication. During the trial, researchers conduct hypothesis testing to determine whether the medication significantly lowers blood pressure compared to a placebo. If the p-value obtained is 0.3, what does this indicate about the null hypothesis, and what should Mr. Anderson understand about the statistical significance of the results? Answer: a p-value of 0.3 indicates that there is a 3% probability that the observed difference in blood pressure between the medication and placebo groups could occur under the null hypothesis, which typically states that there is no effect of the medication. Since this p-value is less than the conventional threshold of 0.5, researchers would reject the null hypothesis, suggesting that the antihypertensive medication has a statistically significant effect on lowering blood pressure. However, Mr. Anderson should understand that statistical significance does not imply clinical significance. A p-value does not provide information about the size or importance of the effect. Thus, even if the results are statistically significant, they may not result in a clinically meaningful difference in patient outcomes. Guidelines from the American Statistical Association (ASAP) emphasize the importance of considering both statistical and clinical significance when interpreting research findings. Discuss the role of social determinants of health in shaping health disparities, providing examples of how these factors can influence access to healthcare and health outcomes. Answer: social determinants of health (ESTO) encompass the conditions in which people are born, grow, live, work, and age, significantly impacting health outcomes and access to healthcare. Examples of SDOH include socioeconomic status, education, neighborhood environment, and healthcare access. For instance, individuals in low-income neighborhoods may face barriers to accessing quality healthcare services, such as transportation issues or limited availability of providers. This can lead to delays in seeking care, resulting in worse health outcomes compared to those in higher-income areas. The World Health Organization, WHO, emphasizes that addressing SDOH is essential for reducing health disparities and improving population health. Furthermore, education plays a crucial role. Individuals with higher educational attainment are more likely to understand health information, make informed health decisions, and advocate for themselves in healthcare settings. Recognizing the influence of SDOH is vital in developing public health interventions aimed at reducing inequities and promoting health equity. In the context of disease outbreak investigation, explain the importance of using both descriptive and analytic epidemiological methods. How do these methods complement each other? Answer: descriptive epidemiology provides an overview of the distribution of disease by time, place, and person, helping identify patterns and potential risk factors. For example, if a foodborne illness outbreak occurs, descriptive epidemiology can reveal that the outbreak primarily affects individuals in a particular geographic area and demographic group. Analytic epidemiology, on the other hand, seeks to identify causal relationships and test hypotheses regarding the associations between exposures and outcomes. Using a case control study, researchers could compare the dietary habits of those affected by the outbreak to those not affected, helping identify specific sources of contamination. The complementary nature of these methods enhances the understanding of outbreaks. A descriptive epidemiology highlights where and whom to study, while analytic epidemiology investigates the why behind the patterns observed. The CDC guidelines for investigating outbreaks emphasize the integration of both methods to formulate effective public health responses and interventions. Ms. Patel is a public health officer investigating a sudden increase in tuberculosis (TB) cases in her city. She decides to conduct a case control study to identify potential risk factors associated with the outbreak. What steps should Ms. Patel take to ensure her study is methodologically sound? Consider factors such as case definition, selection of controls, and data collection methods. Answer: to ensure her case control study is methodologically sound, Ms. Patel should take the following steps. Define the cases. Clearly define what constitutes a case of TB, ensuring it is based on laboratory-confirmed diagnosis to avoid misclassification. Select controls. Choose controls that are similar to the cases in terms of demographics, age, sex, socioeconomic status, but without TB. This helps minimize confounding variables. Matching. Consider matching cases and controls on key characteristics to enhance comparability, especially if certain demographics are known risk factors for TB. Data collection methods. Utilize structured interviews or questionnaires to gather data on potential exposures, e.g., history of close contact with TB patients, previous travel to endemic areas. Ensure that the data collection process is blinded to reduce bias. Statistical analysis. Plan for appropriate statistical methods to calculate the odds ratio and assess the strength of the association between identified risk factors and TB. Following guidelines from the CDC's Principles of Epidemiology will help MS Patel produce reliable findings that can inform public health interventions to control the TB outbreak effectively. Make a study measuring the effect of a new educational program on childhood obesity. Researchers collect data on the body mass index (BMI) of participants before and after the program. Explain how descriptive statistics can summarize the data, effectively highlighting measures that would be most informative in this context. Answer: descriptive statistics are crucial in summarizing the BMI data of participants before and after the educational program. Key measures to report include mean and median BMI. The mean provides the average BMI, while the median offers insight into the central tendency, particularly in skewed distributions common in obesity studies. Standard deviation and interquartile range (ICA). These measures of variability indicate how spread out the BMI values are, helping to understand the distribution of obesity levels within the sample. Frequency distribution, reporting the frequency of participants in different BMI categories: underweight, normal weight, overweight, obese, can visually depict the program's impact on various groups. Pre- and post-program comparisons, presenting the change in mean BMI before and after the program, along with confidence intervals, allows for assessment of the program's effectiveness. Using these descriptive statistics provides a comprehensive overview of the study's findings, enabling stakeholders to understand the educational program's impact on childhood obesity. The American Journal of Clinical Nutrition emphasizes the importance of clear descriptive statistics in public health research to facilitate interpretation and decision-making. Discuss the role of tertiary prevention in the management of chronic diseases, providing examples of how it differs from primary and secondary prevention strategies. Answer: tertiary prevention focuses on managing and mitigating the effects of chronic diseases after they have been diagnosed, aiming to prevent complications and improve quality of life. It differs from primary prevention, aims to prevent disease onset through health education, vaccinations, and lifestyle modifications, e.g., promoting physical activity to prevent obesity. Secondary prevention involves early detection and treatment of diseases to halt progression, e.g., screening for diabetes in at-risk populations. Examples of tertiary prevention include rehabilitation programs. For patients recovering from heart attacks, structured cardiac rehabilitation helps improve cardiovascular health and reduce future risks. Chronic disease management, educating patients with diabetes on insulin management and blood sugar monitoring to prevent complications such as neuropathy or retinopathy. Support groups, providing emotional and psychological support for individuals with chronic illnesses to improve adherence to treatment and foster community engagement. The World Health Organization, who recognizes the importance of tertiary prevention in comprehensive health strategies, particularly in the context of increasing chronic disease prevalence globally. Effective tertiary prevention can significantly enhance the quality of life and reduce healthcare costs associated with advanced disease complications. What criteria should be used to evaluate the effectiveness of a public health intervention aimed at reducing the incidence of smoking among adolescents? Discuss both quantitative and qualitative measures. Answer: evaluating the effectiveness of a public health intervention to reduce smoking among adolescents involves both quantitative and qualitative criteria. Quantitative measures: prevalence rates. Comparing the smoking prevalence among adolescents before and after the intervention can provide direct evidence of effectiveness. Survey data. Analyzing data from follow-up surveys to assess changes in smoking initiation rates and frequency of use can help quantify the intervention's impact. Health outcomes. Tracking health outcomes related to smoking, such as rates of respiratory diseases or hospital admissions, can also be important indicators of success. Qualitative measures. Focus groups and interviews. Conducting focus groups with adolescents can yield insights into their attitudes towards smoking and the intervention's acceptability. Behavioral changes. Assessing changes in knowledge, beliefs, and peer influences regarding smoking through qualitative interviews can reveal deeper impacts of the intervention. Community engagement. Evaluating the level of community involvement and support for the program can indicate its sustainability and effectiveness. According to the Centers for Disease Control and Prevention (ED), a comprehensive evaluation approach that includes both quantitative and qualitative measures allows for a more holistic understanding of the intervention's impact on public health. Define confounding in the context of epidemiological studies and explain how it can affect the validity of study results. Provide an example of A potential confounder in a study examining the relationship between physical activity and heart disease. Answer: confounding occurs when an outside variable is associated with both the exposure and the outcome, potentially leading to a spurious association that distorts the true relationship being studied. This can affect the validity of study results by creating a misleading impression of the effect of the exposure on the outcome. For example, in a study examining the relationship between physical activity and heart disease, age could be a potential confounder. Older individuals may engage in less physical activity and have a higher risk of heart disease due to age-related factors. If age is not controlled for, the study might inaccurately suggest that physical activity levels directly affect heart disease risk when, in fact, the increased risk may be due to the age of the participants. To mitigate confounding, researchers can use techniques such as stratification matching or multivariable regression analysis to adjust for known confounders, as outlined in the American Journal of Epidemiology. This enhances the study's validity and reliability. Describe the difference between vaccine efficacy and vaccine effectiveness. How do these concepts relate to public health policy and vaccination programs? Answer: vaccine efficacy refers to the performance of a vaccine under controlled clinical trial conditions, typically expressed as the percentage reduction in disease incidence among the vaccinated group compared to the unvaccinated group. It assesses the biological ability of the vaccine to prevent disease. Vaccine effectiveness, on the other hand, measures how well a vaccine performs in real-world conditions after it has been deployed in the general population. It considers factors such as population diversity, healthcare access, and variations in vaccine administration. These concepts relate to public health policy as follows. Policy development. Understanding vaccine efficacy is crucial during vaccine trials to establish safety and effectiveness. This informs decisions about vaccine approval and recommendations for use. Implementation. Vaccine effectiveness data is essential for evaluating how vaccines perform in broader populations. This information helps public health officials adapt vaccination strategies, allocate resources, and address barriers to vaccination. Public perception. Effective communication about both efficacy and effectiveness can influence public trust and vaccine uptake. Addressing concerns about effectiveness in real-world settings is vital to improving vaccination coverage. The World Health Organization, WHO, emphasizes the importance of both concepts in formulating effective vaccination strategies that maximize public health benefits. Explain the regulation of glycolysis and its key irreversible steps. How does the regulation of these steps reflect the overall metabolic state of the cell? Answer: glycolysis is regulated at three key irreversible steps: hexokinase HK, phosphofructokinase 1, PFA1, and pyruvate kinase PK. Hexokinase is inhibited by its product, glucose-6-phosphate, indicating that when energy levels are sufficient, glycolysis is downregulated. PFA1 is the primary regulatory step and is activated by AMP and fructose-26-bisphosphate while being inhibited by ATP and citrate. This reflects the energy needs of the cell. Low ATP and high AMP signal the need for more ATP production. Pyruvate kinase is activated by fructose-16-bisphosphate, a product of PFA1, and inhibited by ATP and alanine. This ensures that glycolysis proceeds in accordance with energy availability and substrate levels. Overall, the regulation of glycolysis is an excellent example of how metabolic pathways are fine-tuned to meet cellular energy demands. Dr. Smith is studying a novel gene associated with a rare genetic disorder characterized by severe metabolic dysregulation. Genetic analysis reveals multiple mutations in the gene, including a point mutation that leads to a missense mutation and a deletion that causes a frameshift. Discuss the potential impacts of these mutations on protein function and the clinical implications for patients. Answer: the missense mutation caused by the point mutation may lead to the substitution of one amino acid for another in the protein sequence, potentially altering the protein structure and function depending on the nature of the substitution, e.g., from hydrophobic to hydrophilic. This could affect the protein's stability, enzymatic activity, or interaction with other cellular molecules. The frameshift mutation from the deletion alters the reading frame of the gene, likely leading to a completely different and non-functional protein downstream of the mutation. This loss of function can have severe clinical implications, including disrupted metabolic pathways leading to the disorder observed. The combination of these mutations may result in a complex phenotype that varies in severity among patients, indicating a need for personalized management strategies, potentially including enzyme replacement therapy or substrate reduction therapy, depending on the affected metabolic pathway. Compare and contrast the roles of G-protein-coupled receptor US and enzyme-linked receptors in cellular signaling. Provide examples of pathways that utilize each type of receptor. Answer: G-protein-coupled receptor EUSI are a large family of membrane receptors that, upon ligand binding, activate intracellular G proteins, which then relay signals to various downstream effectors, often involving second messengers such as CAM or calcium ions. An example of a GPCR pathway is the adrenergic receptor pathway, where binding of epinephrine leads to activation of adenylyl cyclase, increasing CAMP levels and promoting glycogenolysis in liver cells. Enzyme-linked receptors, such as receptor tyrosine kinase (RTKS), directly catalyze the phosphorylation of tyrosine residues on themselves and downstream signaling proteins upon ligand binding. A prominent example is the insulin receptor, which upon activation initiates a cascade involving the PICACT pathway, regulating glucose uptake and metabolism. Both types of receptors play crucial roles in cell communication and response, but they utilize different mechanisms and pathways, reflecting diverse physiological functions. Discuss the pathways of fatty acid metabolism, including beta oxidation and lipogenesis. How do these processes interact with carbohydrate metabolism? Answer: Fatty acid metabolism involves two main pathways: beta oxidation and lipogenesis. Beta oxidation occurs in the mitochondria, where fatty acids are broken down into acetyl-CoA units, generating NADH and Fad, which feed into the electron transport chain for ATP production. This process is crucial during fasting or low carbohydrate intake when glucose is limited. Lipogenesis, conversely, takes place primarily in the liver and adipose tissue, converting excess glucose into fatty acids through a series of enzymatic reactions. The key enzyme acetyl-CoA carboxylase AC catalyzes the first step of converting acetyl-CoA to malonyl-CoA, an essential precursor for fatty acid synthesis. The integration of these pathways allows for energy storage and utilization based on the metabolic state of the body. For instance, during excess caloric intake, glucose is converted into fatty acids for long-term storage, whereas during energy deficits, stored fatty acids are mobilized through beta oxidation to meet energy demands. Elaborate on the mechanisms of translation and the importance of post-translational modifications. How do these processes ensure protein functionality? Answer: Translation occurs in the ribosome and involves three main stages: initiation, elongation, and termination. The process begins with the assembly of the ribosomal subunits mRNA and the initiate RNA-carrying methionine. The ribosome then facilitates the binding of ERNAS to the mRNA codons, enabling the sequential addition of amino acids to the growing polypeptide chain. Post-translational modifications (PTMS) are crucial for the functionality and regulation of proteins. Common PTMS include phosphorylation, glycosylation, and ubiquitination. For instance, phosphorylation of serine, threonine, or tyrosine residues can alter protein activity and localization, playing significant roles in signal transduction pathways. Glycosylation: the addition of carbohydrate groups is vital for protein folding, stability, and cell recognition processes. Overall, these processes are essential for the precise control of cellular functions, ensuring proteins are correctly modified for their specific roles in the cell. Describe the mechanisms of genetic regulation, including the roles of operons and transcription factors. How do these mechanisms contribute to cellular differentiation? Answer: Genetic regulation involves mechanisms that control the expression of genes at various stages, primarily transcription. Operons, particularly in prokaryotes, consist of a cluster of genes transcribed as a single mRNA molecule, regulated by a promoter and operator. For example, the LAC operon regulates lactose metabolism in Escherichia coli, where the presence of lactose induces transcription by inhibiting the repressor protein. Transcription factors are proteins that bind to specific DNA sequences, facilitating or inhibiting the transcription of target genes. These factors can act as enhancers or repressors, providing a layer of control over gene expression. The interaction between transcription factors and chromatin remodeling complexes plays a critical role in the accessibility of DNA for transcription. Together, these mechanisms are pivotal for cellular differentiation, allowing cells to express specific sets of genes in response to developmental cues, environmental signals, and cellular context, leading to the formation of specialized cell types within multicellular organisms. Discuss the pathophysiological mechanisms underlying heart failure with reduced ejection fraction (HREF) and how these mechanisms affect cardiac output and systemic circulation. Answer: heart failure with reduced ejection fraction (HFrEF) is characterized by the heart's inability to pump blood effectively, primarily due to systolic dysfunction. The pathophysiological mechanisms include myocardial injury. Conditions such as ischemic heart disease, myocardial infarction, or hypertensive heart disease lead to loss of cardiac muscle cells, reducing the contractile force and overall myocardial function. Neurohormonal activation. In response to decreased cardiac output, the body activates compensatory mechanisms, including the renin-angiotensin-aldosterone system, ROS, and sympathetic nervous system. Increased angiotensin levels lead to vasoconstriction, elevating systemic vascular resistance after load. Aldosterone promotes sodium and water retention, resulting in volume overload and increased preload. Remodeling. Myocardial hypertrophy and ventricular dilation occur due to the sustained pressure overload and volume overload. This remodeling further exacerbates contractile dysfunction, decreasing ejection fraction, decreased cardiac output. The combined effects of myocardial injury, neurohormonal activation, and remodeling lead to reduced cardiac output. This results in inadequate perfusion of vital organs, leading to symptoms such as fatigue, shortness of breath, and fluid retention edema. The interaction of these mechanisms creates a vicious cycle that ultimately results in worsening heart failure, emphasizing the importance of early diagnosis and intervention. Analyze the mechanisms of antibiotic resistance in bacteria and discuss the implications of these mechanisms for clinical treatment strategies. Answer: antibiotic resistance in bacteria arises through several mechanisms, including genetic mutation. Spontaneous mutations in bacterial DNA can lead to changes in antibiotic targets, reducing drug efficacy. For instance, mutations in the penicillin-binding proteins (PBPS) can confer resistance to beta-lactam antibiotics. Horizontal gene transfer. Bacteria can acquire resistance genes from other bacteria through conjugation, transformation, or transduction. This process allows rapid dissemination of resistance traits, especially in opportunistic pathogens. Efflux pumps. Some bacteria possess efflux pumps that actively transport antibiotics out of the cell, decreasing intracellular concentrations and rendering the drugs ineffective. This mechanism is common in multi-drug-resistant strains such as Pseudomonas aeruginosa. Enzymatic degradation. Bacteria may produce enzymes that chemically modify or degrade antibiotics. For example, beta-lactamases hydrolyze the beta-lactam ring of penicillins and cephalosporins, neutralizing their antimicrobial activity. The clinical implications of antibiotic resistance are profound, leading to treatment failures, prolonged infections, increased healthcare costs, and a need for alternative therapies. Explain the physiological mechanisms of acid-base balance, including the roles of the kidneys and lungs. How do these mechanisms work together to maintain homeostasis? Answer: acid-base balance is crucial for maintaining the body's pH within a narrow range 7.35–7.45. The primary physiological mechanisms involved include respiratory regulation. The lungs control the elimination of carbon dioxide, a component of carbonic acid in the blood. Increased Co leads to lower pH acidosis, while decreased Co raises pH alkalosis. Chemoreceptors in the medulla oblongata respond to changes in pH and Co levels, adjusting respiratory rate to maintain acid-base homeostasis. For example, hyperventilation decreases Co, compensating for metabolic acidosis. Renal regulation. The kidneys maintain acid-base balance by excreting hydrogen ions, H, and reabsorbing bicarbonate, TO, from urine. They can generate new bicarbonate and excrete excess H, a slower but more powerful mechanism for correcting acid-base disturbances. In metabolic acidosis, the kidneys increase HCO reabsorption and H secretion, whereas in metabolic alkalosis they may decrease HCO reabsorption. Buffer systems. The body utilizes buffer systems including bicarbonate, phosphate, and protein buffers to quickly neutralize acids and bases. The bicarbonate buffer system is particularly important in the extracellular fluid, where it helps resist changes in pH by equilibrating with Co levels. These mechanisms work synergistically to ensure homeostasis. If one system is compromised, the other compensates. For instance, in chronic respiratory disease leading to co-retention, renal compensation may occur by increasing HCO to maintain a stable P. Describe the adaptive immune response and the role of T and B lymphocytes in this process. How do vaccines leverage these responses to provide immunity? Answer: the adaptive immune response is characterized by specificity and memory, primarily mediated by T and B lymphocytes. T lymphocytes. T cells are crucial for cell-mediated immunity. They develop in the thymus and differentiate into several subtypes. Helper T cells, CD. activate B cells and cytotoxic T cells by releasing cytokines. They are essential for orchestrating the immune response. Cytotoxic T cells (CD) directly kill infected or cancerous cells by recognizing specific antigens presented by major histocompatibility comp MHC class I molecules. B lymphocytes. B cells are responsible for humoral immunity. They differentiate into plasma cells that produce antibodies specific to antigens. Each B cell expresses a unique antibody on its surface which recognizes and binds to a particular pathogen or antigen. When activated, they proliferate and produce antibodies that neutralize pathogens or mark them for destruction by other immune cells. Vaccines leverage the adaptive immune response by exposing the immune system to harmless components of pathogens, such as proteins or inactivated pathogens. This exposure stimulates T and B lymphocytes, leading to the development of immunological memory without causing disease. Upon subsequent exposure to the actual pathogen, the immune system can mount a rapid and robust response due to the pre-existing memory T and B cells. This process is critical for preventing infections and controlling disease spread, as evidenced by the success of vaccines in eradicating or controlling infectious diseases such as smallpox and measles.